knee pain and stiffness, this is how you can instantly increase the range of motion. So what you want to do is you want to hang on, sit on the side of your bed or get on a tall chair or on a table where your leg is just hanging out. And you want to just keep on extending it, flex it, extending it, flex it. And that will start to get this, loosen up the joint, loosen up the tendons and ligaments, okay? You want to do that every single day. Another way is you can use your arm. So the arm, the elbow is just like the knee. So what you want to do is massage all around your elbow, massage all the tendons and ligaments all around your elbow, okay? Everywhere, every section. And then extend your knee as you're doing it. And you'll start to notice that the pain will start to decrease and your range of motion, your ability to pull it back and extend, actually starts increasing. If the one side doesn't work, use the other side and start massaging there all around the elbow joint, all right? Follow me on TikTok.
Hi, my name is Darmel Hudson, and I am a patient here at Acupuncture. I'm actually a registered nurse and have pretty much believed in Western medicine for a long time. I exhausted my options there, felt like I wasn't getting any better, and was referred here. And actually have done it amazingly well. My pain has been resolved. I've been able to walk better than I have in the last 4 to 5 years. So I would highly recommend the acupuncture to anyone with pain issues or any kind of chronic disease.
Hey guys, Jimmy Yin here, the acupuncture neurology specialist, coming to you with another daily power tips, and today is Tuesday. So yesterday I talked about the knee pain protocol that I'm going to talk about today. So just give a little background for those of you who didn't see the video. So yesterday I was telling you, a few weeks ago I was playing tennis and then I was working out and strengthening, and I injured my knee. And so, couldn't play tennis for 2 weeks, and so I've been doing this 3-step protocol. The 3-step protocol does not involve acupuncture, even though I'm an acupuncturist. Normally I would stick acupuncture needles in myself and I would fix it really quick. But not everybody is an acupuncturist, and not everybody can stick needles in their body, right? Please don't do that. But so I wanted to create a protocol that didn't involve acupuncture, didn't involve customized Chinese herbs. I wanted to use simple stuff that everybody can do and everybody can implement at home. Does not require a lot of money, does not require a lot of time, because those are usually two complaints. Oh, I don't have time, I don't have money to strengthen my knee so that I can fix my knee pain. So I wanted to remove all of those objections of why people would not want to take care of their joints. And so I came up with a 3-step protocol that can eliminate your knee pain. And this is what I did, okay? So I tested on my own self, my own body, and this is what I did. So number one thing when you have pain is inflammation. So you want to do things that can decrease inflammation, right? So from your diet, what you put in your mouth, that either increases inflammation or it decreases inflammation. So if you eat a lot of sugar, a lot of animal protein, you're increasing inflammation. You're eating a lot of fruits and vegetables, you're decreasing inflammation, okay? And so I'm not going to go into the dietary part of that. I'm going to go into what I did to decrease inflammation. So I took just one supplement. It's called Clean Omega, okay? Clean Omega. This is the best omega supplement that I have tried. This is third-party tested, pharmaceutical grade. It's made by a company called Douglas Labs, and it's third-party tested by the NSF. So whatever's on the label is actually in the capsule, right? So this is, and this just so happens to be, you can see it's this Clean Athlete, right? It's certified for professional athletes, so they get tested, blood tested all the time, so they need to make sure that whatever they're taking is pure and doesn't have any contamination, other medications in it, right? So this has been certified for professional athletes. And so this is what I take when I play tennis. So what I did was I started with this Clean Omega, okay? And I took 3,000 milligrams 3 times a day, okay? 3,000 milligrams 3 times a day. Now I'm just telling you what I did. This is not necessarily the dosage that I would recommend you because there may be some side effects to taking too much omegas. One of the side effects is diarrhea, right? So if you do have diarrhea, just decrease it. But I'm just telling you what I did. Okay, I'm not saying this is what you should do, but this is what I did to eliminate my knee pain. So 3,000 milligrams 3 times a day, and that's how I started off with number 1. So 3-step protocol, decrease inflammation. So I did clean omega. Okay, I did the omegas. Now some people are going to be wondering, oh, can I use curcumin? Can I use turmeric? Yes, you can, but this is what I have found to work. Okay, and can I use krill oil? Can I use other types of omegas, flaxseed? You know, because this one is from, let's see, tilapia. So this one's from tilapia. Okay, anchovies and sardines. So small fish. Okay. Can you use all those other ones? Yeah, you could. You could try it, but I'm telling you what works. I'm not telling you what you could do. The turmeric, yes, it is a good anti-inflammatory. Does it work for everybody? No, it doesn't. I have found that this specific fish oil does work. Okay, I use it on my patients, but more importantly, I use it on myself. Right? So I drink my own Kool-Aid. So that's what I did for the anti-inflammatory. Step 2, most people think, is to strengthen. No, you don't strengthen first. Step 2 is flexibility. You stretch. Here's the mistake that people make when they're trying to, they have back pain, shoulder pain, knee pain, but we're talking about knee pain. They go directly into strengthening and balancing and stabilizing. No, you don't do that. You want to increase flexibility. You want your tendons and ligaments, your muscles to be stretched. Therefore, it will allow you to do better strengthening exercises without injuring yourself. This is how people injure themselves when they exercise, when they're strengthening, okay? I know different physical therapists will say different things. This is what I've done. Again, this is what I've done that actually works consistently, okay? So step 2 is flexibility. So I've been doing a accountability challenge with a couple of my team members, and for over 2 weeks, I think it's over 2 weeks already, over 2 weeks I've been exercising. I've been doing this every single day. Get up at 6 a.m. doing this every single day. I have not missed a day yet. So when I hurt my knee, it took me 10 days of this to eliminate my knee pain. And I was able to play tennis for 2.5 hours and no knee pain, okay? So flexibility is the second thing. You want to stretch, okay? I'm not going to go into the stretching. I think I'll create like a little module, a training module. If anybody's interested, let me know. I'll create a training module and I'll put it on our platform. Our platform is Achieve Wellness on Demand. It's our kind of Achieve Wellness on Demand. So it's our online platform where we will create different solutions that you can implement at home. Because these things you can implement at home, right? This bottle doesn't cost that much, okay? So flexibility, stretching, costs you 0, costs you time, okay? So I basically, for 10 days straight, 10 days, I did about 20 to 30 minutes each day, okay? 20 to 30 minutes each day, okay? Sometimes I wake up at 6:05, that's why, okay? So 20, 30 minutes each day. Flexibility is second. I do that before I do any type of strengthening. Strengthening is last, okay? And so flexibility is stretching your muscles, stretching all the muscles in your quads, in your hamstrings, in your calves, okay? In your foot, in your lower back. I'm stretching all of those to help my knee pain, okay? So out of, let's say the 20, let's just say, the 20 minutes, 20 minutes that I'm doing this every morning, 80% of it, so what is that, 16 minutes. So 80%, so I'll write here, 16 minutes of it is stretching. Out of the 20 minutes that I'm working out every morning, 16 minutes of it, which is roughly 80% of the time, I'm doing flexibility. I'm not doing strengthening, right? Only the last 4 minutes am I doing strengthening. Now this protocol is not to get, oh, you want to get big quads and all that build, big muscles and body build. That's not what this is about. This is about how to eliminate your knee pain, right? If you want to eliminate your knee pain, you want to spend 80% on flexibility, stretching, and only 20% on strengthening. It's kind of counterintuitive, but if you can do it this way, guarantee you your knee pain will go away, okay? And if you keep on doing this every single day, you get stronger, you get more flexible, your knee pain will stay away. Unless you do something stupid, okay? I can't control that. But if you follow this 3-step protocol, take your anti-inflammatories, eat an anti-inflammatory diet. Step 2, flexibility. Spend majority, 80% of your workout time on flexibility, stretching the muscles, not overstretching, but stretching it, okay? Stretching all the muscles in your body, especially the lower bodies. This is because we're talking about your knee, right? And then the last one, you're doing strengthening. I do calf raises, I do squats, I do assisted squats where I'm using, here's the thing, I'm doing all of this in my closet. I'm not going to a gym, I'm not going to any place specifically, just in my closet, okay? And so I'm doing strengthening with assisted. I'm using the cabinets to help me. So I'm not putting all the weight on my quads and not all the weight on my knee joints, okay? So doing this 3-step protocol can help you eliminate your knee pain. All right, guys, hopefully this was beneficial. If it was, let me know. If you like these things, then yeah, comment, tag, share this post, and let people know, for knee pain. I got, especially if you play tennis, soccer, any running sports, jogging, running, this is very beneficial. So if you can do these 3 steps every single day, the key is you got to do it consistently. It's not like, hey, my knee pain goes away and I can stop all this. No, I still got up this morning. And did these 3 things. Every morning, I have not stopped, okay? It takes consistency to have, the goal that you want. And if you don't want to have knee pain, you gotta do this. All right, guys? Something you can do with no other help, something that you can do by yourself at home. Because I believe, everything is achievable, but it's up to you to make it happen. So if you want to knock out your knee pain, it's up to you to make it happen. All right?